Hi, my name is Dr. Michele Arnold, and I'm a Chief Medical Officer here at Swedish. My grandfather became a quadriplegic after a minor car accident. It turns out he had an uncommon musculoskeletal condition that left his spine vulnerable to injury. I was 11 when I sat by his side, assisting with truncal balance on the mat during therapies while he was in inpatient rehab. I helped clean the pin sites where the halo fixator anchored into his skull. And at that young age, I decided I wanted to be a physical therapist or a rock star, which I still contemplate from time to time. The clinical mentor who comes to mind dates back almost 30 years. Probably influenced by my experience with my grandfather, I took a part-time job with an outpatient therapy group while I was in college. In my 2 years there, I worked as a PT aide under an occupational therapist named Cindy, who taught me to do things that are now considered probably out of scope for a PT aide. I got to apply hot packs. I did therapeutic ultrasound and interferential. I did some limited manual therapies. I counted reps while patients did their resistance exercises. But I recall her demonstrating her own unique blend of patient connection and excellence of care, a mix of human and science. And it was inspiring that patients consistently left better than when they came to us, notwithstanding my amateur efforts. In the late 1970s, most of us thought that rock and roll was the domain of men, and medicine wasn't all that different, minus the big hair and the spandex. In 1977, Barracuda hit the charts by Heart, the duo made up of Rock and Roll Hall of Famers Ann and Nancy Wilson. They were the vanguard women of rock, breaking down barriers in a male-dominated business in which they had few role models. So let me tell a corollary story. So instead of the late 1970s, now the year is 1998. And I'm one of a handful of women in my medical school class of 48. Dr. Nancy Dickey was a professor in the Department of Family and Community Medicine at the Texas A&M Health Science Center and had just been elected as the first female president of the American Medical Association. She was one of 3 women that made up the AMA board of 20 trustees. She was known for her work in health policy and healthcare delivery solutions, medical ethics, and professionalism. She helped develop the AMA Bill of Rights, and she was inducted into the Texas Women's Hall of Fame. These pioneers, like Dr. Nancy Dickey or like Ann and Nancy Wilson, they stepped into the void and they made a way for the women who followed. I think sometimes we can't see the possibilities that haven't been modeled. And maybe all it takes is for one brave soul to break out, break forward. We watch and we learn, and now there's possibility. Then possibility becomes a precedent. As people follow, that precedent becomes a path. So these women leaders of our past, they're the sojourners who bushwhack into the unexplored places, the beyond. They give us eyes to see the real possibility of a flourishing career in medicine as a woman, and they lay the path for us to follow. As of 2019, women make up a little over half of all medical students. However, there are many areas in medicine where women remain underrepresented, in particular, women of color. Certain surgical fields like vascular surgery, urology, orthopedics, and neurosurgery, on average, women have yet to achieve the same level of academic tenure as their male peers. And according to the AMA, women account for just 3% of healthcare CMOs, 6% of department chairs, and 9% of division chiefs. Women of color are absent from many C-suites. There are fewer medical school deans who are women. And moreover, nearly 3/4 of executives pick proteges who look, act, and think just like them. But today, women are leading into these spaces. We're adding diverse ideas and leadership styles to our organizations. On a national level, we're challenging entrenched reimbursement patterns. Did you know that male-specific procedures are reimbursed on average 27% higher than female-specific surgical procedures? We're not bushwhacking anymore. The path is cut, but now we're reaching up and we're achieving higher levels of responsibility and authority. Moreover, we're reaching out and we're reaching down to pull up other potential leaders. I'm excited to see the ongoing march toward equitable pay. I pray that we're the last generation who tells our daughters the story of how we earn less than our male colleagues. I've also seen a change in the character of female leaders in healthcare. When I started down this road, the typical female leader espoused many male attributes: tenacity, authority, certainty, ambition, and maybe in our darker moments, cunning and ruthlessness. We learned really early to lean into our innate resilience, temper our compassionate, empathic selves, sometimes even suppress it, still our tongues, and even value performance over connection. Now we're moving slowly toward authenticity. I see pockets where we're speaking up more when we're silenced. There's still work to be done to change the culture of leadership and make it not only hospitable to women leaders, but teach it to leverage our gifts and better the organization and its connection to our community.